My passion for healthcare really became when my son was diagnosed with cystic fibrosis. So I was looking for a way how to help the community. But before that, I was asking God, not about why, I was asking like, what was the purpose for me to have a son with a chronic condition? And I was like, okay, I have a mission. Through that personal experience, I became not only a better person, I am more sensible to the needs of others. When he was 7, they were telling me many things that I never accepted. So I try and I pursued to change his life. And that's how JKare started, the respiratory system. So we started with respiratory therapy. Then we continue with challenges in the industry.
Hello, friend. Welcome. I'm your host, Carlene Cadet Francois. I am here with the amazing, caring Alba, and I'm so excited to have the conversation with her today. I think you're going to love her. I met her. I happen to love her very much, and she can't stay away from me. And I can't stay away from her. Karen is a healthcare executive, patient advocate, and co-founder of JKare, a South Florida company specializing in respiratory care and home medical equipment solutions. She holds a MBA in healthcare management and is an honorary member of the American Association for Respiratory Care, recognized for her advocacy and contributions to the respiratory care community. Karen is passionate about improving patient outcomes, supporting caregivers, expanding access to quality respiratory care, and building partnerships that drives innovative in healthcare. My God, Karen, I love that. Oh my goodness.
Thank you so much, Miss Carlene, and thank you so much for the audience. I am very happy when I also met you. It was a very nice connection. I'm always talking about her experience and about how good she is. When even when you talk to her, you feel that love, that passion, and I cannot stop talking about her. Even when I'm in meetings, I always have to say something about her. Like she's, if I can describe how you are, I can say that you are an inspirational person.
Thank you. I appreciate it. And you are an inspirational person too. And two powerful women get together, loving to serve people and to make a difference. It's epic. I'm so excited to have you on today. Can you tell the audience a little bit about yourself?
Thank you so much. I am more excited about the invitation. It's been an honor for me to participate in this podcast with Miss Carlene. I am originally from Colombia. I am been in the US for 26 years. My background is in healthcare management, but my passion for healthcare really became when my son was diagnosed with cystic fibrosis. So I was looking for a way how to help the community. But before that, I was asking God, not about why, I was asking like, what was the purpose for me to have a son with a chronic condition? And I was like, okay, I have a mission. So through that experience, through that personal experience, I became not only a better person, I am more sensible to the needs of others. So that's why every single day I see that what I do, it's not a work, that what I do, it's something that motivates me every single day to wake up with more love, more passion to be able to help others.
I love that so much. There is some things you cannot fake. And I don't know why people fake because the truth always ends up coming out anyway. But when you have to deal with caring for someone in a personal level, and that's what drives you to care for others, and that same personal mindset, because you know what it's like to feel how the other family members are feeling and how that client of yours is feeling. I just feel like we serve from a different perspective. And the way that we do it is priceless.
Yeah, I can talk to you here about all of my accomplishments and educational backgrounds, but for me, like anyone can go to school and can learn something. But when you decide to turn your life and just to serve, and when you decide like something that you have inside that you can become not only a better person, but when you can impact others, like when you can make their quality of life better. Because not only, remember, not only in my case, the patients, not only the residents in many of your cases, but also about the families. My son, it's having a full life. He's been accomplished a lot for what all of when he was 7, they were telling me many things that I never accepted. So I try and I pursue to change his life, not because a condition, not because of a diagnosis. And I said, like, I am going to make a change. And that's how JKare started. And that's how we created this organization that we started with the name of Pediatric Respiratory Care of South Florida, Inc., because we started
Wow.
only with 10 patients, and it was PED patients, and it was only for respiratory therapy.
Mm-hmm.
So we had to change the name to JKare because I was advocating so much for the patients, and also the
Mm-hmm.
patients were transitioning from pediatric to adults. So the services are not the same when you have a pediatric patient or when you have a patient that is over 21 years of age. So
Mm-hmm.
I started learning more. I start loving more what I do. Every single day is a challenge. So a lot of people, they ask me like, but why in this type of business? I say like, because since my son has the condition and I know like many issues that we're having and many roadblocks that I went through for his care,
Mm-hmm.
and I wanted to make the difference. So I
Mm-hmm.
am grateful that God gave me the opportunity to learn and to work in something that it's not only able to help my son, it's been impacting life, like not only in the United States. We volunteer in Colombia. We help
Mm.
patients. In the beginning, we just started with patients with cystic fibrosis, but it's the need is in all patients that have chronic conditions, and not
Mm-hmm.
only respiratory conditions. I am not a respiratory therapist. I am not a healthcare provider. I have to say that, but I really love what I do. That I always am in the learning process. But all
Mm-hmm.
of those conditions that affect the respiratory system. So we started with respiratory therapy. Then we continue with challenges in the industry. And since in the beginning we did not require a ACA license, then it was required.
Mm-hmm.
The only path it was through a DME. Now we are able to have license for the respiratory therapy through an exemption, but it was like all of the roadblocks that we were able to overcome, because it's not only just having a business, it's also to comply with the regulations and the standards in the industry. So I am not a master in what I do, but I'm very confident that what I do is the right way to do it. And that's why I feel so good talking about this, because like I said, like you can talk and you can learn and you can go through a handbook and talk to people. But when you have this experience, the life experience with the professional experience and with the eager to learn, I think that you become not only a better person, but a better professional, a better mentor for others. And I wanted to help. And this is what I wanted to do. The same as you, like you know everything in regards to your industry. And I see how people, they respect you because where you can give to the community, sometimes they have no clue or no idea that they wanted to open the business, and when you talk to them, they have to think twice because it's also a commitment.
Yes. And it's a level of responsibility too, because when people look at you for mentorship and they can rely on information you're providing to them, it's a responsibility to make sure you're meeting that expectation and you're exceeding it. And then you're doing the right thing and you can be at peace. And I think it goes a long way. It's amazing to see your heart in the way that you do what you do. Tell us a little bit more about all of the different aspects that JKare covers within your caregiving journey and the services you provide.
Well, at JKare, we are not just a simple provider. We wanted to be a clinical partner, and that's what we are trying to explain. It's not a pitch because
Mm-hmm.
we are not here to sell. I'm here to resolve a problem.
Mm-hmm.
So we have different line of business within the organization. We provide home respiratory therapy, which are clinical services in which the respiratory therapists, based on a patient evaluation, they go and provide services to a patient. Of course, this service has to be medical necessity. Within the respiratory therapy line of business, We also have ventilator programs in which many organizations, pretty much intermediate care facilities, they have vent units in their organizations. So as a respiratory therapy company, we are licensed, we are insured, like we comply with all of the requirements to operate in the state of Florida. Because remember, anyone can open a corporation here in Florida, but not everyone is running the business the way that they are supposed to do it. So to run an intermediate care facility ventilator unit, it is tough. And you have to have not only the credentialing, you must have the experience, and the therapists, they must have the skills and everything to be able to coordinate that, because that is a life support equipment. So within the respiratory therapy, anything that it comes and that we can help patients having difficulty breathing or conditions that are going to affect the quality of life, we are there to help. We also provide DME services throughout the state for specialty equipment. We specialize in specialty equipment because we have the team and the resources to be able to go to Tampa, to go to Fort Lauderdale, to go to Orlando, because we have therapists throughout the state for the DME. And we have Meleway for many supplies. We have Meleway for nebulizer machines. But when it comes to specialty equipment, we send the therapist to the patient home. Miami-Dade and Broward, we cover everything from enteral, tracheostomy supplies, disposables, everything, oxygen, we do it. Because those are, like, for example, for oxygen, we have to be in the range in which we can go quickly and resolve any emergencies, as well as mechanical ventilation. We also have, an oxygen license, and we also hold a healthcare license in which our therapists can also provide services to hospitals or other facilities. And we are in the process to add more disciplines to that license, like medical personnel, nursing, any type of therapists. We are in the way. So, but we're focused a lot now. It's in DME, because we noticed that many companies, they are not clinical partners. They are there just to provide the services. But we want to be your clinical partners. We want to support you in any need that you have with patients in your assisted living community.
Yes, I love that. So you basically are a provider for respiratory care. You send your therapist either to the assisted living or to the person's home to provide that care. And then you are an equipment company for caregiving. And you also provide services, deliveries, and different equipment, caregiving types of equipment, wheelchairs, for example, beds, supplies, and different things like that, right?
Yes.
Okay.
Suction machines, CPAPs, BiPAPs, AffloVest, which I'm going to talk to you about that one, because that it will be a great asset for the patients that are in assisted living communities with COPD.
Tell us a little bit about it.
We have different type of equipment. The issue with a respiratory therapy is that it's not covered through Medicare. It is only covered through Medicaid up to 21 years of age. In order for you to obtain coverage for respiratory therapy once you are over 21 years of age is if you have a long-term care program. If you do not have a long-term care insurance, then we have to look for a way how to help that patient to stay within the community. It is not only going to impact the patient's health, because once the patient is admitted into a facility, everything starts again for the patient, like the discharge planning, new needs. And maybe that patient cannot go back to the assisted living community because that patient health status is in another stage now, because we didn't take care of the patient when the patient most needed. We are distributors for a chest wall oscillation therapy. In this case, is the AffloVest. It's a vest that the patient uses with the assistant. Many times it's with the assistant of a respiratory therapist, but they can do it with other type of health when the therapist is not covered. It's good because it's going to help the resident in this care to mobilize the secretions, to expectorate better, and to have the lungs very clear. For patients with COPD and those chronic conditions, it is amazing. We have noticed that those patients, if they use it every day, if they are in compliance with the prescribed frequency, the possibility of reduction, ER visits and hospitalization is very low. Those are cases that were studied by the manufacturer, and it's also an FDA approved piece of equipment. It's technology. When patients does not expect her, once again, I am not a respiratory therapist. I wish I am a respiratory therapist, but I love what they do. And since I run a respiratory therapy company, I have to learn about how can each equipment help the person. I am not here to sell. I am here to help you to resolve an issue that you may have now, or you don't know that it's going to happen in the future, and I can help you to avoid that issue. So in that case, Medicare will cover the AffloVest. So it's like a cap rental type of equipment that for the first 30 months, Medicare is going to pay to us. The assisted living facility doesn't have to pay to us. We bill Medicare for the patient. So we're always there. The good thing about JKare as a DME company is because we are a local company. I'm proud to say that we have more than 12 respiratory therapists on staff. Yeah, I am not going to send someone without license, to your place. And everybody that works in our company, they comply with the minimum. Actually, we have our standards are very high because we are accredited. So we have to comply with everything that they need to go and visit a patient. Sometimes, I know other companies, they send people to the patient home. They don't have proper license. They don't have proper documentation. So if I wanted to do something, I wanted to do something good. I am here to help. I am here to collaborate. I am here to try to minimize issues in the future. But most important, I am here for the resident. I am here for the patient. I am here for the client, because in your case it's resident, in our case it's patient, in other one is client. So I am here for everybody. And if we are all providers that we care for a patient and we have to be in the plan of care for that patient, we all need to be in the same page. And a lot of people, they don't know what are the tools that are out there to start avoiding problems that they have.
I agree. Coming from the fact that I manage, let's say, for example, an assisted living watching this. So it would look something like this to you. You call JKare company. You have a residence who their doctors determine that they need respiratory care. They give a doctor's order. And then you'll reach out to Karen's company. They come out and they'll provide the services to you. So you do accept Medicare, Medicaid. I assume that you also accept private pay from the family in case, they don't qualify for any of those things. And for me, as the assisted living administrator, I'm making the connection between you and the family and the resident's doctor. And then you're coming out to provide the services, the respiratory care to that resident, according to what the doctors say that residents' medications needs to be. And then on top of that, you're also able to provide supplies and equipments and different things, because as our seniors age, they need more and more help, and also equipment help us to care for them at a different level. And it really makes our jobs much easier as long as we know how to use those equipments and that we have policies in them and that we're training our staff to use them. Do you also provide training? Let's say, for example, a family member needed a specific type of equipment, or a resident needed a specific type of equipment. They're not sure how to use it. Do you provide any type of help with how they can go about using it?
We have to. It is not like we must, we maybe no, we have to. And that's what I always said, like, we are your clinical partners. We are there to collaborate with you to make it happen, because if you don't know how to use an equipment, how can the resident it's going to be able to accomplish the goals for what the equipment was intended to be prescribed? If we are going to be sent a cough assist, you don't know how to use a cough assist. You don't know why is the purpose for the resident to use a cough assist or a suction machine. That's why we have our staff, respiratory therapists, that they are trained. They not only know about equipment, they have license and they know about patient care. So if something happened, like, we are not an emergency service company. But if something happens, they are there and they are able to help you and to minimize any risk that may happen with the patient. What happened, like respiratory therapy is one thing and the DME is something different.
Mm-hmm.
Let's say in the case that you have a patient, like I said, Medicare does not cover respiratory therapy. However, long term, private insurances and self-paid are good resources for reimbursement. But let's say the doctor send a prescription for respiratory therapy. The first thing they do is they send a prescription for an evaluation. Not every patient qualifies for home respiratory therapy. I have cases in which I send the director of clinical services to evaluate a patient, and also we have other leaders that they are able to provide evaluations in which they say, no, the patient does not need respiratory therapy. I just need to train the caregivers about this, and this will resolve the issue. Because we had those cases in which, since the doctor it's not seeing the environment, he won't be able to determine. But once I send the therapist will evaluate everything, like what does the patient have. The patient may have a nebulizer, but the patient is not using the nebulizer correctly. The patient is maybe have oxygen, but the oxygen it's not set up properly, or the filter, something is happening, and the patient is getting congested, or whatever, something. I am not a clinician.
Mm-hmm.
So we have been able to resolve, even during the evaluation, the problem. So once, that's one thing, that's the evaluation. If the patient qualifies, the respiratory therapist will determine and will suggest to the prescribing physician what is the need that that patient may have. One day per week won't resolve an issue. It's going to be worse. They are getting used to the therapy. So, because I'm seeing those cases. And then they get mad because the therapy hasn't gone there. It's one day. It's not. We suggest at least 3 times per week, because that way the patient would receive a better care, and it is constant care, and the plan will accomplish better, and the health it will maintain. So once we have that evaluation, the therapist has to create a plan of care. That plan of care is going to be sent to the doctor, and then we have to request authorization depending on the insurance. It is a process. I wish that I can have the power to do it like a magic wand, but unfortunately, we have to go by what the insurance says. Once we have everything, then we send the therapist to visit the patient. That is when it comes to the therapy services. When it comes to equipment, the doctor already knows what they are going to send to the patient, but sometimes it depends on the equipment, because there is equipment that is costly. Even though we require the clinical documentation, sometimes the clinical director wanted to take a look of how that patient looks to see if that equipment will benefit the patient or not. I am not an overnight provider. I am not a last resource provider. I am not an emergency provider. That's what I said to all of my referral sources. If you want someone that just provides something without doing the proper documentation or following the proper procedures, I won't do that. Because I am the number one advocate for the patients. But at the same time, I wanted to sleep good at night. You know, I have a family. A lot of people depends on what I do. So, and I wanted to leave a legacy. I don't want my name to be anywhere. So
Yes.
I am preaching that, so I better do that.
Yes.
And that's why I can say I am here, because I'm not hiding for nobody. I am doing the right thing. It's slow, but one day I will get there. If not, I am writing very happy every single day doing what I love the most.
I love that. Even the Bible talks about a good name, right? When you're born, you're given a name, and it's your responsibility to keep that name a good name, because there are so many blessings that comes with having a good name. I love it. And I also like how you that patient approach, because as ALF providers, ALF owners, and people who work in caregiving, we don't like when our client have to go to the hospital. And I tell my audience, if your client have to go to a hospital, send one of your staff members with them, so they are not alone, because we know seniors don't like new faces. A lot of them have dementia related issues, and they're confused and they don't know what's going on. They can't talk for themselves, and calling 911, you're sending them to the hospital by themselves. It should not be, right? We're not required to do it, but you should do it. And the family members will award you for it, you know. So I love the fact that you are looking at the client as a whole. You are working with their doctors, their providers, because it's true. Sometimes the doctor don't know what is going on with that patient in whole. And if you can work with them hand in hand to make sure issues are avoided, especially in the caregiving space, it goes a long way. Because if you could imagine, if a family member is caring for their children, meanwhile they have a job, meanwhile they have a life, they have their own selves to worry about, they can overlook certain things. And I can see how it can be so hectic. So when it comes to assisted living and being involved in the caregiving space, what are the most common challenges that you see ALF residents face and often go unnoticed, in things that could lead to them being hospitalized?
The number one is like, first one is the communication with the team. Sometimes they overlook a simple sputum in a patient. I am confident talking about this because this is what I see every single day also in the home setting.
Mm-hmm.
So our therapists, when they see something, they immediately report it to the director of clinical services, and we contact the doctor, explain the situation. They can act really fast trying to get a sputum collection, send it to the lab, and the doctor would determine what to do without taking that patient to see the doctor face to face or to go to hospital. However, that doctor can communicate with the patient in a telehealth because the patient continue, at least trying to struggle with the condition, but it's not in that bad shape yet. What happened in the assisted living communities is they overlook symptoms. I am not talking in general, but I am talking just about a problem that they don't see it in the future. That is one, like we can avoid admissions or unnecessary ER visits related to any bacteria infection or
Mm-hmm.
because they overlook just a symptom or sign that it was the sputum. Another thing, it could be a patient with sleep apnea. Well, the patient doesn't sleep, but have they see what the patient doesn't sleep? Is the patient being evaluated by a professional in sleep study that can see what's going on? Because a lot of people,
Mm-hmm.
they don't believe that a patient with a sleep condition have or develop. I'm sorry again, I have to disclose, I am not a clinician, but I love what I do. I read a lot. I am passionate about this, but they develop other conditions like cardiac conditions. So many cases, just little symptoms are overlooked. Patients that they have, you mentioned dementia, residents with dementia that they have problem like swallowing or they have aspiration pneumonia. So there are we have a lot of patients that what they try is to avoid complications. We have had patients with a lot of conditions, 114 years old, and they were like, I need my therapist. And I was like, I'm impressed that we can also translate this to the assisted living communities. Patients like 15 years receiving respiratory therapy. And I'm being tracking the hospital admissions. And I call a mom because I was like, is this real? And I said, Mom, your loved one hasn't been in the hospital or in the ER for the past 15 years. And I asked her, are you happy with the services? And she asked me, why? I am very happy. Are you taking my services away? And I said, like, no. I just wanted to know if this is true what I'm seeing, because every time that I'm reading this information, it maintains. And she said, like, well, because of the respiratory therapy that your company is providing, my loved one, it's been able to stay at home. And do you know, because we have parents that are a lot involved, do you know that this type of care is the ones that insurance companies, they have to look at because it lowers the cost of, of care when you care of a patient with a chronic condition, like patients that are very fragile. So remember, we take care of pediatric patients and also adults. So assisted living communities, they can take advantage of our services even to accomplish their goals as a facility or the mission or their vision, because we are there as an add services to their members. Like, we wanted to be a partner that you can count on even before you have the problem. I always mention before you have the problem as a prevention, because when you have the problem, sometimes it's going to be hard and it's not going to be effective, because those members can, many of the cases, cannot continue living in the assisted living community. They will be transferred to another type of organization because the needs are going to be completely different. So it's just to have an open mind and to evaluate other provider services that are going to be helpful and beneficial for your residents and your company as a whole.
Yeah, it does make a big difference because if you're able, in Florida, we have age in place policies to make sure our seniors can stay with the same group of people as long as, everyone keeps doing what they're supposed to do with the caregiving and treating the client right. So let's say, for example, you started with a standard license and you want to provide extra services to your seniors. You can opt in for a designation of a LNS license, a ECC license, and then someone like Caring Company and other companies out there that provide services, different sets of services your seniors will develop. Because over time, they get older and unfortunately, things get worse. And if you don't have the right type of provider relationship before you have these problems, you end up losing a client. And it's not good for the client because now they have to be exposed to a whole bunch of new people. We know they don't like that, and then you are also losing an income,
Exactly.
and you don't want to place yourself in that situation. And yes, it is true, being able to have resources before you need them, it's very important. And I can see Karen as well collaborating with the APD group homes because they
Yes.
have different levels of care that they provide, adults and children, and that's another area. So if you're APD group home, you're watching this, you need to reach out to Miss Karen because she can help you.
Yes, I love the actually with APD. I have a very good connection for what they do. They do take care the needs of their clients. They call it clients seriously. We have members for DME and also for therapy, ventilator members, because they have the group homes, depends on patients
Hmm.
that the needs. And it is amazing. They are on top of everything. Like, even like the authorizations, they send it to me before I request it. So they are on top, and it's a little bit hard because they are picky because their standards are a little bit higher. But challenges, I love challenges, and wanted to make a difference. We wanted to be a different type of providers. I always answer my husband and I were the owners. My son works with us as well. My niece, she works with us. My sister works with us. So we are a family-owned business,
I love.
and we know, like, we all could be working somewhere else with less stress, making more money, because this is a challenging work. Sometimes if a patient is admitted, we don't earn income as you, but and as a company, I have responsibilities. I have to pay license, rent, employees. But since we love what we do, we wanted to be here for you. And you will be also my clients. Because if you are not
Hmm.
happy with our services, the ones that we're going to be providing to your residents, then, it's going to be a problem.
Yes, it will be a problem. Which leads me to what advice? I think you've already given some advice. Is there any other advice you would give to assisted living communities, APD group home communities who want to build stronger healthcare partnership with others out there in the community to better care for their residents?
The suggestion that I will give is always look for providers who are invested in your residents, in the patients, in the clients, not just in their financial gain, or
Hmm.
not only to sell their services. Because the stronger partnerships, they come with the providers that are really aligned with the care. Not just because I just wanted to have a nicer car or to go somewhere else. No, I am here. Our company, as the company JKare, is here because we know the need that there is in the community. And I'm always advocating for the patients. Sometimes it's funny and hard to say because I fight for the patients.
And that's how it should be. We
Exactly. No,
should,
I said, like, don't give me the authorization. Send it to somebody else, but give the service. And
yes.
because sometimes it's hard when an insurance, they have people that they don't know exactly the contracts that their company has with the state, or they don't have the knowledge of the minimum coverage services through that insurance. But like I say, every single day I have to learn something new. So I challenge that. So not even a month ago, I went to an event and I was talking about the services, and it came one of the case managers saying thank you in front of everybody. My name is
Uh,
such. Remember, you told me this, and you told my boss, because he said, like, how do you know that you know more than my boss, that he's a CEO? And I said, like, I don't care if he's a CEO. He doesn't know. This is what it is. So I sent all the information. Because the thing is, like, many providers, they go by what they said because they believe also that they know more than anybody else.
mm-hmm,
In my
mm-hmm.
case, at least I know the minimum coverage services that a patient is entitled to. And like I said, send it to somebody else, but at least, please, that member or that resident in your case needs the service, because if I am able to do that, I am able to help that person to receive the care they need and to avoid many problems in the future, and also to increase their lifespan, which that's something that I love to do.
Yeah, we all deserve that. We all deserve to have good care, to have good people around us, to feel love. I think those are basic needs.
Yeah.
And I love how you're able to do that even while educating. You will always find someone who is in a position who think they know it all, but no one knows it all. We all have been exposed to different situations, and therefore now we have a different perspectives in a situation that we've been dealing with. It could be for decades, but now we have a new perspective on how to deal with it because of that exposure.
Yes.
Thank you so much for being here today. Is there anything else you want to share with my audience?
Oh, yes. Visit JKare.com, and you can also find us in Instagram as JKare Miami. I am here to help, and thank you to the audience. And I hope that you can call me and you can ask me questions. You can, through the website, you can find my information, you can find my email. But thank you so much, Miss Carlene, because without you and without your professionalism and your passion and love, I wouldn't be here too. So I'm gonna tell you something. You know what I'm wearing this blue color?
Hmm.
Because she says to me the day that she met me, I was wearing this color, but it was in the
Yes.
jacket and black inside. And the first thing that she asked me, were you the one that were wearing the blue
The blue?
jacket? And I was like, you know what? I want to wear blue today, because that also creates in my mindset something that she was looking at me while I was talking. So you have marked my life, and you have made me love also assisting living communities. And something that I didn't mention, it was like I was a volunteer with the state as an ombudsman program, and I
Mm.
learned so much, and I became passionate about this. Unfortunately,
Wow.
I didn't have the time that it requires and the commitment, but I am always here to help.
Ah,
And,
that's
I am
amazing.
here always.
That
Thank you
amazing.
so
I
much.
love your heart. You're so welcome. You're so
Thank
welcome.
you. Thank you.
And Karen will also be at the next Assisted Living Caregivers Conference. I tell people, when you're talking to me, I'm doing my best to listen, and I remember more conversations and more people than people realize. You know how sometimes they say, you see so many people, how did you? But I do remember because I care. I care about each and every one of my people, and I love them, and I think they love me back, and I appreciate it.
Oh, thank you. The last thing that I'm going to say, a lot of people ask me why J care. Now that you mentioned that you care, J is for my husband Julio. K
Mm,
is for me, Karen, but we care.
wow.
So that's what it's called, J care.
Wow. That's amazing. I love
Thank you.
it. I love it. So please reach out to Miss Karen, ask her any questions, let her know if you had a big takeaway from this conversation. And I know in ALF communities, caregiving, different caregiving aspects, you deal with these equipments. You deal with how do I get this covered? You know, what do I need to do? She'll be able to point you in the right direction. Please consider like, subscribe, and share this video with someone that will find it valuable. If you have not registered for the Assisted Living Caregivers Conference, click the link in the description, learn more. 2027 is going to be epic at the Palm Beach Convention Center. It's going to be epic January 29th and 30th, 2027. We've been selling those tickets. Click the link in the description. Come hug me and Miss Karen, okay? We look forward to seeing you. Until next time, I'm Carlene Cadet Francois. We are focused in giving you resources and helping you achieve your highest purpose while serving our seniors and people who are in need of our care. Until next time, I'll see you soon.